Hello everyone, and welcome back to the Hama Pet channel. In today's video, I'm going to share 5 essential tips for handling pet health emergencies during the holidays. Stay tuned and let's dive in together. The holiday season brings warmth, joy, and festivities into our homes. But for our beloved pets, this time of year can present unique challenges and potential health risks. While pet owners naturally want to include their furry family members in celebrations, the season's changes to routine, environment, and diet require careful consideration to ensure pet safety and well-being. During holidays, most regular veterinary clinics operate on limited schedules or close entirely, making it crucial for pet owners to be proactive about pet care and aware of emergency veterinary services in their area. Understanding common holiday-related pet hazards and knowing how to prevent them can help avoid stressful emergency visits and ensure pets remain healthy throughout the festive season. Food-related concerns. Holiday meals and treats pose significant risks to pets. Rich, fatty foods commonly served during celebrations can cause severe digestive issues, from mild upset stomachs to potentially life-threatening conditions like pancreatitis. Turkey bones can splinter and cause choking or internal injuries, while common ingredients like onions, garlic, and certain spices can be toxic to both cats and dogs. Traditional holiday sweets present another danger. Chocolate, especially dark or baking chocolate, contains theobromine, which is highly toxic to pets. Sugar-free treats containing xylitol can cause rapid blood sugar drops and liver failure in dogs. Even seemingly harmless items like bread dough can expand in a pet's stomach, causing severe discomfort and potentially requiring emergency intervention. Decorations and holiday plants. The transformation of our homes during the holidays introduces new hazards for curious pets. Christmas trees, whether real or artificial, can tip over if pets climb them or play with ornaments. Tree water may contain harmful fertilizers or bacteria, while fallen pine needles can cause digestive problems if ingested. Electrical cords from holiday lights attract playful pets but pose shock hazards if chewed. Many traditional holiday plants are toxic to pets. Poinsettias, while less toxic than once believed, can cause mild irritation. More dangerous are holly berries and mistletoe, which can cause severe gastrointestinal upset and cardiovascular problems. Even Christmas cactus and amaryllis can be harmful if consumed by pets. Routine disruption and stress management. The holiday season often disrupts pets' regular routines, leading to anxiety and behavioral issues. Changes in feeding schedules, exercise patterns, and sleep habits can affect pets' physical and mental well-being. The constant flow of visitors, unusual noises, and altered household dynamics can create stress for even the most sociable pets. Maintaining as much normalcy as possible helps pets cope with holiday changes. Regular feeding times, consistent exercise routines, and dedicated quiet spaces where pets can retreat from holiday chaos are essential. For particularly anxious pets, consulting with a veterinarian about temporary anti-anxiety solutions might be beneficial. Holiday travel and pet care. Whether traveling with pets or arranging for their care while away, proper planning is crucial. If pets are joining holiday travels, ensure they're comfortable with car rides or air travel, and research pet-friendly accommodations in advance. Required documentation, including vaccination records and health certificates, should be organized well before departure. For pets staying behind, carefully vet potential pet sitters or boarding facilities. Provide detailed care instructions, including feeding schedules, medication needs, and emergency contact information. Familiar items like beds, toys, and treats can help pets feel more secure in temporary environments. Emergency preparedness. Despite best precautions, holiday pet emergencies can occur. Create an emergency kit including basic first aid supplies, copies of medical records, and contact information for regular and emergency veterinary services. Know the location and hours of the nearest 24-hour veterinary facility, and keep information about pet poison control hotlines readily available. Recognize signs that require immediate veterinary attention, such as repeated vomiting, difficulty breathing, sudden lethargy, or ingestion of harmful substances. Having a plan and acting quickly in emergencies can make the difference between a minor incident and a serious health crisis. Positive holiday experiences. While awareness of holiday hazards is important, pets can safely participate in seasonal celebrations with proper precautions. Create pet-safe holiday traditions like giving appropriate toys as gifts or preparing special pet-friendly treats. Include pets in calm holiday activities while protecting them from overwhelming situations. The key to successful holiday pet care lies in balancing festive inclusion with consistent routine and safety measures. By maintaining awareness of potential hazards, preserving regular schedules, and preparing for emergencies, pet owners can ensure their beloved companions enjoy a safe and happy holiday season alongside their human family members. Understanding when to seek emergency veterinary care can be challenging for pet owners, especially during holidays or after regular business hours. While emergency veterinary services typically cost more than routine visits, delaying necessary emergency care can lead to worse outcomes and higher eventual costs. First steps when your pet shows health issues. When you notice concerning symptoms in your pet, start by calling your regular veterinary clinic, even if they're closed. Many clinics have after-hours answering services or recorded messages directing clients to recommended emergency facilities. Some veterinarians may be available for phone consultations, helping you determine whether immediate care is necessary. Your regular vet knows your pet's medical history and can often provide valuable guidance. They might also have arrangements with specific emergency clinics, potentially streamlining the transfer of medical records and ensuring continuity of care. Identifying true emergencies. Certain symptoms and conditions require immediate emergency care. Breathing difficulties, labored breathing, excessive panting, or blue-tinged gums indicate severe respiratory distress requiring immediate attention. These symptoms can rapidly worsen and become life-threatening within minutes to hours. Severe trauma. Injuries from accidents, falls, or fights need prompt evaluation. Even if external wounds aren't visible, internal injuries can be serious. Signs of pain, limping, or behavioral changes after trauma warrant emergency assessment. Ingestion of toxic substances. If your pet consumes potentially harmful items like medications, chemicals, or toxic foods, immediate care is crucial. Time is critical for successful treatment of poisoning cases. Contact pet poison control and head to an emergency clinic immediately. Acute severe pain. Signs include crying out, reluctance to move, aggressive behavior when touched, or unusual vocalization. Conditions like bloat in dogs or urinary blockages in cats cause intense pain and require immediate intervention. Neurological symptoms. Seizures, severe disorientation, or inability to walk straight indicate neurological issues requiring urgent care. Multiple seizures within 24 hours or seizures lasting more than 5 minutes are especially concerning. Severe gastrointestinal issues. While occasional vomiting or diarrhea might not require emergency care, severe or prolonged symptoms can lead to dangerous dehydration. Emergency care is needed for repeated vomiting, bloody diarrhea, or suspected foreign body ingestion. Life-threatening conditions. Situations like difficulty giving birth, heat stroke, or suspected internal bleeding require immediate professional intervention. These conditions can deteriorate rapidly without proper medical care, when immediate care may not be necessary. Some conditions, while concerning, might not require emergency care. Minor gastrointestinal upset. Single episodes of vomiting or diarrhea in an otherwise active pet who's eating and drinking normally can often wait for regular veterinary hours. Mild limping. If your pet can bear weight and shows no signs of severe pain, monitoring the condition until your regular vet opens may be appropriate. Minor wounds. Small cuts or scrapes that aren't bleeding heavily can often be temporarily managed at home with basic first aid. Chronic conditions. Long-term issues that haven't suddenly worsened typically don't require emergency care. Cost considerations and decision-making. Emergency veterinary care involves higher costs due to specialized equipment, 24/7 staffing, and immediate availability. Understanding these factors helps in decision-making. Diagnostic costs. Emergency clinics often require upfront payment for initial examination and diagnostic tests. These might include blood work, X-rays, or ultrasounds needed to assess your pet's condition. Treatment expenses. Emergency procedures and overnight monitoring increase costs significantly. However, delaying necessary care often leads to more extensive and expensive treatments later. Financial planning. Consider pet insurance or establishing an emergency fund for unexpected veterinary expenses. Many emergency clinics offer payment plans or accept care credit options for large bills. Making the decision. When deciding whether to seek emergency care, consider these factors. Severity assessment. Evaluate how significantly the condition affects your pet's basic functions like breathing, eating, drinking, or mobility. Behavior changes. Dramatic changes in behavior, especially lethargy or unusual aggression, often indicate serious problems. Time sensitivity. Consider how long until your regular vet opens and whether your pet's condition might worsen during that time. Quality of life. Assess whether your pet is in significant distress that impacts their immediate quality of life. Preparing for emergency situations. Take these steps to prepare for potential emergencies. Keep emergency information accessible. Maintain a list of emergency veterinary clinics in your area, including their locations and phone numbers. Gather medical records. Keep copies of your pet's important medical records, including vaccinations and current medications. Create an emergency kit. Stock basic first aid supplies and any specific medications your pet regularly needs. Plan transportation. Know how you'll transport your pet to an emergency clinic, especially for larger animals or during difficult weather conditions. The role of prevention. While emergencies can't always be prevented, regular veterinary care reduces their likelihood. Regular checkups. Maintain scheduled veterinary visits to catch potential health issues early. Preventive care. Keep vaccinations current and follow recommended preventive treatments for parasites and common diseases. Environmental safety. Pet-proof your home to prevent accidents and ingestion of harmful substances. Diet and exercise. Maintain appropriate diet and exercise routines to prevent health issues that might lead to emergencies. Seeking emergency veterinary care can be a difficult decision, especially considering the higher costs involved. However, when your pet's health is at risk, prompt professional care often makes the difference between successful treatment and serious complications. Understanding what constitutes a true emergency and being prepared for such situations helps ensure the best possible outcomes for your pet's health while managing the financial aspects of emergency care effectively. Seeking emergency veterinary care can be a difficult decision, especially considering the higher costs involved. However, when your pet's health is at risk, prompt professional care often makes the difference between successful treatment and serious complications. Understanding what constitutes a true emergency and being prepared for such situations helps ensure the best possible outcomes for your pet's health while managing the financial aspects of emergency care effectively. Trauma and physical injuries. Severe physical trauma requires emergency care. Open wounds risk infection and significant blood loss. Broken bones need immediate stabilization to prevent further damage. Burns, even if seemingly minor, can worsen rapidly and are prone to infection. Vehicle accidents may cause internal injuries not immediately visible but potentially life-threatening. Gum color changes and circulation issues. Normal gum color should be pink. Pale or white gums indicate poor circulation or blood loss. Blue or purple gums suggest oxygen deficiency. These changes can signal shock, internal bleeding, heart problems, or respiratory distress. Press the gums. They should return to pink within 2 seconds after pressure release. Toxic exposure management. Common toxins requiring immediate care include medications, human or veterinary, chemicals, antifreeze, cleaning products, foods, chocolate, grapes, xylitol, plants, lilies, sago palms, pesticides, and rodenticides. Document what was ingested and when. If possible, bring the packaging to the vet. Temperature abnormalities. Normal temperature ranges.
Dogs, 101.0-102.5 degrés F, 38.3-39.2 degrés C. Cats, 100.4-102.5 degrés F, 38-39.2 degrés C.
High temperatures indicate fever or heat stroke. Low temperatures suggest shock or severe illness. Both extremes can cause organ damage if untreated. Pain and vocalization. Unusual crying, whining, or howling often indicates severe pain or distress. Cats typically hide pain, so vocal behavior is especially concerning. Changes in vocalization may signal internal injuries, urinary blockages, neurological issues, severe gastrointestinal problems, respiratory distress. Breathing difficulties require immediate attention. Warning signs include open-mouth breathing in cats, extreme chest movement, blue tongue or gums, inability to rest comfortably, stretched neck position. These symptoms can indicate heart failure, pneumonia, asthma, or airway obstruction. Abdominal distension. A swollen abdomen, especially when accompanied by pain or vomiting, may indicate gastric dilatation volvulus, bloat, internal bleeding, fluid accumulation,
Organ enlargement.
This condition can rapidly become life-threatening, particularly in deep-chested dogs. Seizure management. Seizures lasting over 5 minutes or multiple seizures within 24 hours constitute an emergency. They can result from toxin exposure, head trauma, brain tumors, metabolic disorders. Record seizure duration and frequency for the veterinarian. Emergency care protocol. 1. Remain calm. 2. Call emergency vet while en route. 3. Safely transport pet. 4. Bring relevant medical records. 5. Document symptoms and timeline. Immediate professional care for these conditions can prevent severe complications and improve recovery outcomes. Schedule management. Maintain consistent feeding times, walks, and rest periods despite holiday disruptions. Track your pet's daily routine using a shared family calendar. Designate a family member to oversee pet care responsibilities during events or travel. Environmental safety. Create a quiet retreat space for your pet away from holiday activities. Secure holiday decorations, especially electrical cords and glass ornaments. Keep toxic plants like poinsettias and mistletoe out of reach. Ensure tree stands are stable and cover tree water to prevent consumption. Food safety protocols. Establish clear rules with guests about not feeding pets. Post a visible "do not feed" reminder near dining areas. Secure garbage bins to prevent access to food waste. Keep holiday treats and cooking ingredients in sealed containers out of reach. Health monitoring. Check these daily indicators: food and water consumption, urination/defecation patterns, energy levels, behavioral changes, physical symptoms, vomiting, diarrhea, coughing. Document any concerns and contact your vet promptly if issues arise. Guest management. Brief visitors on pet rules before arrival. Supervise all pet guest interactions. Provide clear instructions to pet sitters about routines and emergency procedures. Keep emergency vet contact information visible. Travel preparations. If traveling with pets, update vaccinations. Pack familiar items. Maintain feeding schedules. Plan regular breaks. Carry medical records. If boarding, book early. Provide detailed care instructions. Leave emergency contacts. Update vaccinations as required. Contact your veterinarian immediately for medical emergencies, difficulty breathing, severe bleeding or trauma, seizures or collapse, suspected poisoning, unable to urinate/defecate, severe vomiting/diarrhea, behavioral changes, sudden aggression, extreme lethargy, loss of appetite greater than 24 hours, changes in water consumption, unusual vocalization, confusion or disorientation, physical changes, limping or mobility issues, swelling or lumps, changes in gum color, unexpected weight loss/gain, Skin problems or hair loss, eye/ear discharge, preventive care, annual wellness checks, vaccine updates, dental examinations, parasite prevention, weight management, senior pet care adjustments. Keep your vet's contact information readily available, including regular office hours, emergency after-hours number, recommended emergency clinic, pet insurance details if applicable. Document observations about your pet's condition before calling, including when symptoms started, changes in behavior or routine, recent diet or environment changes, current medications. Your vet's familiarity with your pet's history enables them to provide targeted care and determine urgency level. Monitor your pet's health closely during holiday activities. Watch for changes in eating and drinking habits, activity levels, bathroom routines, social behavior, sleep patterns. Take preventive measures. Maintain regular feeding and exercise schedules. Secure decorations and hazardous items. Brief guests on pet safety rules. Keep emergency vet contacts accessible. Document any concerning symptoms. Contact your veterinarian immediately for sudden behavioral changes, signs of illness or injury, suspected toxin exposure, difficulty breathing, severe digestive issues. Remember, early intervention often prevents serious complications. Your pet relies on you to recognize and respond to health concerns promptly. While celebrating the season, prioritize your pet's well-being to ensure happy, healthy holidays for the entire family. Always choose your pet's health over convenience. The cost and effort of preventive care or early treatment is far less than managing a serious emergency.